Okay, I think we are good to get started. Welcome everyone to Cadillac Fairview's Mental Health Speaker Series. We are excited to be hosting the third session of this four-part webinar series that will focus on how best to support your mental health and the mental health of those around you. This series is part of Cadillac Fairview's Occupant Engagement Program and will conclude on Tuesday, December 7th. Last week, we had Larissa from Mindful Momentum facilitating the self-care session, and today we have Kathleen from the Psych Company hosting Coping with Anxiety and Depression. Finally, on December 7th, we will be handing it off to Mia from Therapy Collective, who will be facilitating an art therapy webinar. If you would like more information about the next session in the series, please email courtney.laurie@cadillacfairview.com, the email that's contained in your RSVP. We will be circulating an email at the end of the series with links to the recordings as well as a short survey. We ask that you take a few minutes to complete the survey to help us continually improve on the Occupant Engagement Program. And without further ado, I'll hand it off to Kathleen to lead us through the session.
Thank you, everyone. Thanks for being here today. I just wanted to make a comment. It's a pleasure being here. It's lovely to be invited by Cadillac Fairview's Occupant Engagement Program, and I appreciate your attendance. I'd look forward to providing you some insight and maybe even some psychoeducation in regards to anxiety and depressive symptoms and how to manage and cope during this time, as well as any time in the future. I did want to make notice that in the chat, someone is commenting that audio is cutting up, and I was just wanting to make sure that everyone can hear me clearly because I did see those comments as audio is cut up. If it's fine to continue, then I will continue. So just want to make sure you can all hear me and see me as well. So just an introduction of who I am and what I do. I'm a registered psychotherapist in the province of Ontario. Psych Company. I am a representative of Psych Company as a team lead supervisor, but just wanted to give you an introduction to who we are and what we do. I'm going to ask you to flip the slide for me, and I'll introduce to our founders, our founders of the company. If you can flip the slide. So initially, Krista Rissler and Mark Bryan came together to create Psych Company in 2019. During this, they'd been a company prior to that, but just had really firmly set up offices in the Toronto area. I know that our offices are close by. And we also now obviously offer virtual services because of the pandemic, and definitely have gone that route for most beneficial reasons to provide services and assistance to those individuals who are seeking assistance. Now, Krista, although she's a co-founder, she's also a registered psychotherapist and a life coach. Mark Bryan is a co-founder and a managing partner. Krista, being a psychotherapist and a life coach, she's a natural person who shows up for our appointments. She is our lead, as well as Mark supporting all of us therapists. And we definitely know that there is extreme passion and as well a calling to do this type of work. They are definitely engaged in wanting to promote mental health within the Toronto area as well as throughout the province of Ontario. And we are hoping that what you're learning here today is just a portion of what we could provide as services. We do provide many different types of services. We work with individuals that do suffer from symptoms of anxiety and depression or have been diagnosed with, but also with other difficulties that they're experiencing, either relationship, either individual or couples counseling. We provide services for life coaching, career building, personal and professional development guidance and assistance, and really focusing on helping individuals achieve the life that they're trying to create without having things and barriers get in the way that they have some control over. Like I explained, if you can flip the screen, I'm a registered psychotherapist. I've been practicing for about 23 years. I have worked with many psychologists and psychiatrists as well as medical practitioners over the years, neurologists and special general internists. And I've learned a lot from the medical world as well as from the psychological world, working in multidisciplinary teams and interdisciplinary teams, but also working independently as a private practice counselor. Working with individuals with chronic health conditions, chronic pain, relapsing from substance abuse, etc., and working with terminal illness, grief, and loss. The clients that we see are obviously seeking assistance with, the issues that they're having within their own life, and they are struggling to attain the things that they want to have in their lives. So a lot of the work that we're doing is considered cognitive behavioral therapy, but also a third generation considered acceptance and commitment therapy, which is also focusing on a values-based lifestyle so that you're living the life and creating the life that you are intending to the best of your ability. If you could flip the screen. Just a little bit about Site Company. Like I mentioned, Mark and Krista joined forces, and they're now getting both used to their unique strengths and passions toward building a business that truly helps to change and make positive difference in the lives of clients, their families and friends, as well as to the therapists that they're working with. The founders continually strive to build a culture where employees are not just staff, but are usual partners to contribute to building the vision of the company. With many industries, and especially in the field of health and mental health, there's no shortcuts, and maintaining your well-being takes time. We're all about well-being within our own office and with our staff, as well as with our clients that we're working with, so that we're helping within the community. If you could flip the screen, please. The topics for today, I was asked to speak about coping with anxiety and depression. And I just wanted to shift the words a little bit because I find that, coping and managing is part of really the strategy here that I would like to help with. At no point, am I making any diagnosis because that's outside of my scope of practice. And everybody who is attending today, I hope that if you are seeking assistance, please ask questions. Maybe at the end, I'm going to intermittently ask questions as well that maybe you can join in the chat. But really what I'm doing here today is providing psychoeducation in the realm of what are symptoms of anxiety and depression? How is it impacting our lives? What is mental well-being? Understanding anxiety and depression, including holiday or winter blues. I'd like to, mention to you when to get help when it's more serious and concerning. Who are the people to talk to? Determining, looking at who and what matters to you and really establishing, thinking about goals and values though that are behind that. So putting values into action, and then learning how to build awareness skills and using helpful coping strategies. Okay. I do have questions in between that you're more than welcome to, pop in as we go along. I know that there's been comments about the sound prior, and it looks like everything's managing much better now that I hope that that you can hear the audio better at this point. I do want to just mention, like I said, this is really an introduction. It's not meant to be, that there's some diagnosing going on or that I'm providing therapy. And if you have questions for me after, I do have our contact information on the last slide. Okay. So in regards to, practicing some activities here, if you would like to, while we go along, in the session. If there are things that you would like to practice, I'm going to give a little bit of instruction here or there towards the end of the session. You don't need to participate, but if you would like to, there's just going to be really brief examples or exercises that I'm going to do with you, but please don't feel obligated to do so. Okay. So firstly, I just wanted to talk about, what are the impacts of change on mental well-being? Life is ever changing, and at times we do struggle with change. Change can be positive. Change can be, a move, a new job, a promotion. It could be, a birth of a child. It could be a birth of a third child, whatever it might be. People consider those things usually positive changes. There's also negative changes that you might kind of consider the typical negative change. What would be negative? Perhaps, a loss of a job, a layoff, a death of a loved one, disappointments in relationships, people not being supportive. And, those types of changes are things that, we don't necessarily know how to handle them, and they can impact our mental well-being. So a big question you want to ask is, if change is within our control, what happens? So things that we control, and I'll have a slide later on about this, about control and not control, right? But looking at it from the standpoint of when change is positive, we often look at it as, maybe there's something that I had to do with this. And often some of the negatives are outside of our control. Like if it's an illness or death of a loved one or friend or loss of a job, that is outside of our control. Whereas the things like having a child, making a move to a bigger home or a nicer area, having, making some travel, living a different lifestyle, those things are things that we say are within our control. And often that's where those positives or negatives come about. Okay. So often, I'm going to ask you to flip the next slide. I just want to kind of briefly mention what is mental health, because we're talking about mental health. Mental health affects how we think, how we feel, how we act, how we make choices, and how we relate to others, and how we handle stress. If we have poor mental health, we kind of make some judgments saying maybe these are the things that we're not thinking, feeling, or acting, or making the choices that are leading us towards the life that we want, and we're not handling stress. We're often overwhelmed. If we have change that occurs in our lives, does it mean that we'd be unwell mentally? Not necessarily. Sometimes change is just our readjustments. So think about this. You're moving to a new home and there are definite stresses of change. Now I have to set up this. I have to wait for this delivery person. I now have to redecorate. I have to set up a whole world from one home to another and transition and manage banking issues and finance issues. And really, those changes, although they are deemed to be positive, still can impact us mentally. And really what we're looking at is how are you managing the change? Because change will be disruptive to how we handle things. Change does require us to readjust. It requires us to have a reset and then to still keep moving forward, because really there are no other options other than to keep moving forward. Okay, you could flip the screen. Now here talking about how to manage change better, and I'm not calling everything stress. I'm just wanting to enforce that this is managing change, because change is ever existent. How to manage change better is asking questions like, why do some people manage change better than others? We don't necessarily know every aspect of that. Sometimes it's a personality trait. Sometimes it's the circumstances. Sometimes it's the approach. But typically, helpful approaches would be, during change, if someone is willing to be flexible. And what I mean by flexible is not have rigid thoughts of black or white, that it must be this way or it must be that way, but to say it is how it is and I'm going to work with it. Also, the willingness to be curious about, the experience that you're having. Say, this is interesting. I've never been here before. What do I do now? Or how do I manage this? And then also being reflective of yourself. What are my strengths here? What can I do to help myself with this change? So really, it's about being introspective. It's about observing our behaviors. What kind of things do you take action to do? And can you foresee the consequences of some of those actions or behaviors and decisions that you make? You want to be mindful, and this is a word that we use out there in our world of therapy, and I know that it's quite a common term based in social media realms or in different outlets, that being mindful and patient during transitions is really a helpful skill or strategy. But that's an easy thing to state, just be patient. Often that can actually irritate individuals, even just with those words, to make a statement of be patient during transition. Change takes time, but it is true. The more we are patient, the more we are probably able to manage the consequences of change, even if they are considered positive or negative. For example, the need to be social again or returning to an office, that is change that is occurring. We're all adjusting to the world opening up, possibly closing down, opening up, shutting down little bits here and there, and managing these changes and being flexible with it. All change can be uncomfortable, and typically even the considered positive change will be uncomfortable and somewhat stress-inducing. Okay, we can change the slide. When I mention here, inquiring minds want to know, when change is happening, that's outside of our control, we often struggle with the adjustment to change unless we deem it to be helpful in our lives. Who doesn't wish to win a lottery or fantasize about moving to the tropics during wintry Canadian blizzards? Those might be unanticipated, but they still can induce a stress response. That was an example that I wanted to give. There could be positives, deemed positives, but still impacting us. If a person experiences change that they don't control, like the loss of a job or death of a loved one, discord in a relationship, or being in lockdown during the pandemic, they can react poorly with increased anxieties, worries, low mood, emotional dysregulation due to significant changes to their daily activity and feeling restricted, to name a few. Okay, you can flip the slide. What can happen when we're struggling with our mental health? Okay, or when we're struggling with change, or when we're looking at things in a negative way or kind of fixated in that way, that we're feeling a little bit overwhelmed. Sometimes we stop doing the things that matter. And when the feelings or symptoms start showing up, when we start feeling out of control, anxiety and depression show up as well, those types of symptoms. So I want you to understand some symptoms of anxiety and depression. This is by no means diagnosing anybody because of this list. If you're feeling that there is a need to seek out a diagnosis that you're concerned about, I do always recommend that you see a healthcare practitioner, excuse me, if it's your doctor. Your family practitioner can provide you either a referral. If they're not comfortable with mental health concerns, they can send you off to a mental health practitioner, a specialist. That would be a psychiatrist, as well as psychologists can provide diagnoses. The difference between a psychiatrist and a psychologist is a psychiatrist is a medical practitioner and medical doctor, and they can prescribe prescription medications. A psychologist has either a PhD or a PsyD degree or double MA, or they became a psych associate and moved through the chain to be called a psychologist. They would not be able to prescribe any form of medication, but they can provide a diagnosis in order to assist an individual to learn strategies and skills dependent on that diagnosis. Okay. So some of the common symptoms of depression and anxiety, including the holiday and winter blues. I just want you to pay attention to that since we're entering into the season. There are possible changes in sleeping habits, either positive, meaning not positive, meaning an increase or a decrease of sleeping. Eating habits, same thing, an increase in eating or a decrease in eating. Low appetite, not just feeling blah, not eating, and other people may eat more when they're feeling these symptoms. Mood changes, appearance changes. So if you could be observing these things of yourself, or perhaps those people that you care and love for, that you could pay attention to this and draw out this as a concern if you're noticing these changes. If there's a change in interest, hobbies, activities that they like to do, social activities. Change in movements. Individuals who all of a sudden start walking slower or talking slower, or they're extremely restless or agitated, moving around quickly, shaking. Those are things to pay attention to. Nervousness, inability to relax, irritability. Maybe they get angry or overwhelmed quickly. Maybe they're short with the people that they, would normally not react poorly to in that way of being irritable. There can be an increase of alcohol and substance use. There can be a loss of energy, feeling like you're dragging yourself out of bed all the time, going to bed early, napping in the day. Or increased energy is also something to pay attention to, like that their mind is just running a mile a minute. There's not enough time in the day to get anything done. And that can be just in general if we have too many yeses in our lives that we're saying yes to. But increased energy in a surging kind of way where, you might only sleep 2 or 3 hours. Those are some things to be concerned about and pay attention to with those people around you or for yourself. Okay. Same with difficulty concentrating, making mistakes at work or within the family, forgetting appointments, forgetting to pick the kids up from school, whatever it might be, forgetting important meetings. Those are types of things that are some symptoms. This is not the endless, it's quite a long list of other items. I do want to mention for holiday and winter blues, you may notice that, as the sun is changing and our nights become much longer, and our evenings are such, in the summertime, we can be outside for many hours in the day and enjoying the sunshine. We have a very limited amount of time of sunshine. So, the fact that we start hibernating is a typical term that people will use, and they shut down. They just don't want to go out once it's dark. Noticing that and paying attention to it. It's not something just to slough off necessarily, not necessarily. If you could flip the next slide. So how to get help and seek assistance, when to get help. At any time, if any of you are experiencing suicidal or homicidal thoughts, it's absolutely necessary that you consult a doctor, call 911, or seek help at the closest emergency room. This is not something to wish away or hope that it goes away. This is something to be addressed pretty significantly and quite quickly. I know there's lots of frustration that individuals will have, if they have already gone to hospitals and may not have gotten the attention that they needed, or they don't feel that they're being listened to. I'd still would always recommend, contacting these services as a number one. There's also distress centers within your communities, and all different communities have different phone numbers, but a distress center is a typical line that they have. Some areas in Ontario have a 211 phone number. That also can provide assistance if you dial that number within your community. Okay. In general, the individuals that I'm typically working with, or the clients that we're typically seeing within Psych Company in our realm of work, are not individuals who are needing crisis intervention. Those are not our services typically, but all of our therapists are trained in crisis intervention and providing assistance when. And at times we do have to breach confidentiality when someone's at risk to themselves or to others. This is not something that any of us take lightly. But when there's a circumstance where someone is either when they're actively suicidal or homicidal, those actions do have to take place. And we do take that very seriously. In the realm of the work that we do in our world of Psych Company and with other psychotherapists, here the example here is talk therapy. When to get some help for those symptoms of anxiety and depression that I mentioned before, or even the holiday blues, is talk therapy, particularly cognitive behavioral therapy, or the third generation acceptance and commitment therapy. These can effectively treat symptoms with you. Okay, if you feel you have these symptoms, seek help of a trained registered mental health professional. It's important to make sure that there are no other medical conditions that are causing these symptoms, because there can be a variety of medical conditions. And I'm always going to promote an individual to see their family doctor on a regular basis for yearly checkups, making sure, you know, there's blood work being done if necessary with a change in someone's symptoms, if they're noticing, you know, the increased demand for sleep, or the irritability, or the loss of appetite, anything like that, are things to address with medical practitioners first. If it's deemed that an individual is healthy physically, then it's always something that this, you know, talk therapy and psychotherapy can be brought into the picture. And even at the same time, if you're waiting for assistance in medical investigations, it would be helpful as well to potentially seek out these types of therapies and psychotherapy. Regarding seasonal or winter blues, while symptoms will generally improve on their own with a change of season, symptoms can improve more quickly with treatment. And it can help individuals learn strategies that can assist them in years to come, because every year that we're alive, we have this holiday season and winter time, other than if you live in the tropics. So we could flip this slide. Okay, I want you to pay attention. You know, I mentioned before, determining who and what matters to you. With that, you know, in my realm of work that I do focus primarily, that's kind of an initial assessment date, is who and what matters to you. And how do you refocus, you know, your choices and what gets your attention? Because sometimes we don't really think about these things. Who matters to you? You can take a minute to write down names of, you know, 1 or 5 individuals that are important to you. You know, even a pet's name. You can think about a special pet, a person that is not here anymore, that has passed away. Could be you on that list of who matters to you. And you don't need to share it with me. I'm not asking for sharing on the chat, but maybe just jotting down the individuals that are important to you and paying attention to that. And then from that standpoint, I want to have you make a list, you know, of a takeaway of what matters to you. Now, what do you stand for? What's important to you? Now, at your 80th birthday party, if you can imagine that scene, what would you want people to be saying about you at your 80th birthday party? Now, who would you want to be there celebrating this special day? You know, if we're looking at the things that matter, and these are just a few examples of some values that might exist, you know, personal growth, spirituality, work, health, parenting, being a member of the community in good standing, having intimate relationships, social relationships, enjoying leisure and hobby activities. You know, it takes time to figure this out. It's not something that you're going to have this aha moment in our conversation today in this presentation, but it's something that I'd want you to kind of contemplate a little bit and take the time to figure out who matters to you and what matters to you. From that standpoint, you know, looking at trying to set strategies up to do more of the things that matter to you with those people that are important to you, trying to make plans, establish some goals so that you're doing certain activities with those individuals, the things that are important to you, or on your own. And having less of the things that take you away from those important people that matter and the things that matter to you. That's kind of step 1 with paying attention to how to manage, okay? Some of the coping strategies that we're talking about to manage these symptoms of anxiety and depression, and even the holiday blues. There's informal mindfulness exercises that we can learn. There's simple grounding exercises that people can learn. And a simple grounding exercise, it's not complicated. You could do it right now with me, is just sit in your chair, kind of settle into your chair, readjust, and put your feet firmly on the ground and kind of press them into the ground. Just notice that the ground is underneath you, supporting you. Okay. Think about your body in the chair, think about the cushiness of your chair or the uncomfortableness of the chair. Maybe put your hands on the chair arms, push down into the seat of the chair, push your back into the back of the chair, and just notice, the support of the chair. And then as you're noticing, notice that you're here presently, shoving your feet into the ground, and that you're supported by the earth around you and the space around you. That's an example of a very brief, and that's not how I would necessarily do it, but I'm trying to flip through quickly, of a really brief grounding exercise. I'm here, I'm sitting here, and reminding yourself of that when you get lost in thoughts and feelings. Sometimes those are difficult thoughts and feelings, sometimes they're exciting thoughts and feelings, but they can be anxiety provoking, especially if they're forward thinking. And sometimes the depressive thoughts and thinking can be things that we're worrying about or sad about from our past. So to bring you back to the now, informal mindfulness exercises, grounding exercises. There's very formal mindfulness exercises that you can find on a number of different apps, different books about mindfulness, and also a very, CBT standard method is progressive muscle relaxation, learning how to relax muscles in your body that you're walking around holding in a tense state. That really impacts your breathing and impacts, your pain and fatigue. Sometimes those are the things that go along with anxiety and depression. Okay. Some other coping strategies. I know last week you learned a little bit about self-compassion, and the presenter provided a book called Self-Compassion by Kristen Neff. It's definitely a helpful resource, creating that kindness to yourself, taking time to be reflective and, be your best friend sometimes, not to necessarily be harsh towards yourself. And we often, in those moments, of the anxiety and depression symptoms showing up, when I talked about irritability or aggressiveness, it actually can be turned towards self too. In that, at times we might have negative self-talk, harsh self-talk, very non-compassionate approaches or unkind approaches to ourselves. When I talked a little bit about, knowing what you control and what you don't control is part of that awareness, learning, when things are outside of my control, how do I handle things? When things are within my control, can I step into it and put effort into the things that I can control? Setting boundaries, doing the things that matter. Another coping strategy is, physically getting active again, getting out for a walk in the sunshine, dancing in your kitchen, working out at a home gym or in an outside gym. There are lots of ways. If you're medically cleared to do so, part of a coping strategy would be to engage in those types of activities. Realistically, also planning daily activities that are meaningful to you. So some people wake up early, they start a schedule at an early time, they practice some mindfulness, they listen to podcasts, they get their day started, they do some yoga, whatever it might be. Or maybe it's just that they want to plan out their day and have their coffee on their own. But truly planning some meaningful activities that mean something to you. Calling a friend, visiting someone that's, needing a visit, spending time at your work day doing your meaningful work. And then lastly on the list, although this is not exclusive, this is not the end point of the list, is pristine sleep hygiene. Really paying attention to how you're taking care of yourself and your health is based on some of the sleep strategies here. So if you could flip the page for me. I'm just going to give some examples of a mindfulness activity. Simple ways to become present. And I'm going to go through this really quickly. It's just about the 5 senses. And it's a brief breathing exercise and a settling in exercise. And it's really using your 5 senses and counting down 5, 4, 3, 2, 1. And using, your sight. Name 5 things that you can see. Name 4 things that you can touch. Name 3 things that you can hear, 2 things you can smell, and 1 thing that you can taste to bring you back into the moment. When we get caught up in our thoughts and feelings, sometimes that's all we need to do. Or another example of an informal kind of exercise that it's not listed here, but it's like brushing your teeth. Just pay attention to the water running, pay attention to the taste of the toothpaste, think about the bristles in your mouth, what the difference is before brushing your teeth and after brushing your teeth. Just kind of be mindful in those moments and exercises of your day that we sometimes just blindly run through. And those practices can help us slow down. You can do these at practices anywhere without anyone knowing. And really, these are simple ways to become present and taking care of yourself. If you could flip the next screen. This is just, asking yourself when addressing some worries, what can I control? Now, I can control personal boundaries, the things in the center, how I spend my time, my habits, my mindset, my choices, my intentions. Those are types of things that we can control. But I cannot control what other people think of me. I can't control world events. I can't control other people's choices. And learning to know the difference between what can I control and what I can't control will definitely play a big role in how you manage symptoms of anxiety and depression, because sometimes we get so overwhelmed and we realize these are things outside of my control. So how do I manage? And it's learning about being patient, as I mentioned before, and learning to focus on doing the things that matter that you can take control of. And sometimes letting it sit to say that is the circumstance when it's stuff outside of my control and being okay with that. If you could flip to the next chart or next page. I want you always to check your batteries, check in how you're currently feeling. Don't forget that you have choices to make, and sometimes our choices have consequences that are positive, and sometimes they are not so positive. They can be negative consequences. So making sure that you're taking care of yourself by checking in with your battery. If you're feeling great, if you're feeling meh, if you're struggling, pay attention to those things. Practice, some mindfulness checking in, but then also veering towards what can I do about it? Can I do something? Okay, and try to take action with those things. If you can flip to the next screen. Sleep hygiene, I mentioned, better sleep equals often better mood. And if you think about life if you could section it off into 3 buckets of the 24-hour window. So think about 3 buckets of 8 hours. Kind of our target goal is 8 hours of sleep a night, 8 hours of work a day, and 8 hours to do the other stuff on top of then that you get the weekend, hopefully. So you get 16 hours on those times, unless you work weekends. But think about, if you spend a third of your life sleeping and a third of your life working on an average, what about the other third of your life? And you want to be able to be productive, to engage in things that you enjoy doing, to do meaningful things. They might be silly to one person, but really important to you. But follow through in doing those things, especially if they're meaningful to you. Okay, but also taking time to sleep and practicing good sleep hygiene. We could flip to the next screen. Things like watch your tea, your caffeine intake altogether, any type of caffeine. Alcohol and cigarettes just before bed, it's pretty much a no-no. Everyone thinks they might have a drink and it'll help them sleep. It actually causes sleep to be more problematic. If you're exercising, exercise about 3 hours before you're planning on going to bed. If you can keep all stressors out of the bedroom, don't have arguments in the bedroom, don't bring work into the bedroom, really leave it outside that bedroom space. Blue screens on your phones or on your tablets is probably best if you're going to bring it in the bedroom, but it's best to practice paper in the bedroom and if you're doing some light reading before bed. But you can take these slides afterwards. I won't go through all the details there. Okay. Another strategy to handle anxiety and depressive symptoms is setting boundaries. Really knowing what's important to you. Don't be afraid to ask for what you need, and saying no is an option. So saying yes to everything is not always the best way. And one of the last slides I have here is, This is from a quote from a book called Act Made Simple. Having negative thoughts and feelings means I'm a normal human being. This is by Russ Harris and Stephen Hayes. Now, it's not to say that negative thoughts and feelings float in and out of everyone's minds. And I'm suggesting here, and they are also recommending here, that we realize that that's normal. We're not meant to just be happy all the time, walking around with a smile on our face. There are going to be thoughts and feelings that show up that are difficult. If they're showing up more than half the time, if they're showing up and interrupting certain things in your life that don't make sense, that you're not settled with, or that there is a change, those are the times to seek out some assistance and get some guidance, and not to be afraid. You know, it is normal to have feelings, and it isn't abnormal to have feelings of anxiety and depression or the winter blues. It's not abnormal, but it also doesn't mean you have to sit in your suffering either. So there can be things that you can do to make that better and more manageable. And on my parting thoughts, you know, on the next slide over, just want to acknowledge feelings, be compassionate with yourself and others around you at work and at home. I want you to try to learn to celebrate daily successes and the ways that you have coped, and try to be deliberate about balancing your life, your sleep, your waking, and setting boundaries. And if you need to contact us at all, feel free to visit www.sitecompany.com or email us. And the last page is just some resources. So any questions? I know that we kind of flew through things and the time has gone quickly. Anybody have any comments or questions that they'd like to post up either on the chat? I know that you don't have mics that you can speak into, but if there's any chats, any questions or comments, I'm happy to answer some questions. And if not, it's understandable. It was a lot of information to take in a short period of time. And I hope that this, thank you for your comments, Kimberly. I do hope that if you have any questions, you're more than welcome to reach out to Site Company or to our facilitators today. I do believe that they're going to be providing my slides and resources as well to everyone that attended. And I do wish you well during this holiday season. I hope that you're able to take some time for yourself and do the things that matter with those people that matter to you. And I do think taking some time to do so will be helpful. Doesn't mean that it's going to solve the problems. We're not always problems to solve. Sometimes it's situations that we have to learn to sit with. Thank you.
Hey, thank you so much, Kathleen, and thank you everyone for attending. If you have any questions, feel free to stick around. Want to look into those resources? They're on the screen there. And yes, I believe you can share the slides after as an email to take a look at some of the resources that Kathleen mentioned.
I just wanted to say thanks again to Cadillac Fairview for inviting us as Site Company and myself to attend and present. And I hope this was helpful to you, as I mentioned, and that you have some takeaways, you know, and for the winter season, the holiday season, and just in general for life.
Sure. Thank you, Kathleen.
Okay. Thank you.